Hi everyone, I am Dr. Suraj Chirania, hemato-oncologist and BMT physician in Mumbai. Recently, I have seen one elderly person, 68 years old, having a fever on and off going on since last 3 months. He had a history of weight loss and he required some Paxil red blood cell transfusion recently. When I examined the blood reports, he found to have low hemoglobin, low WBC, and low platelets. When we examine physically, there was swelling inside the abdomen, means there was enlargement of spleen. So we done the bone marrow test on this elderly patient. Then it confirmed a diagnosis of hairy cell leukemia. It was diagnosed because on the peripheral smear, means blood, there are some hairy projection on lymphocytes. Then on the bone marrow flow cytometry, there are markers which are typical of hairy cells were present. So coming to our point, what is this cancer? What is hairy cell leukemia? Hairy cell leukemia is a cancer that is very slow growing, that mainly affects the B lymphocytes. B lymphocytes are the type of white blood cells that helps body to fight the infection. What are the risk factor and causative factors? Usually the most important is the age. Most of the peoples are more than 65 years of age, more or slightly prevalent in the males compared to females. Otherwise there are no occupational, radiation or chemical risk factors present. The symptoms of hairy cell leukemia are slowly weight loss. Most people lose weight more than 10 pounds in 6 months to a year's time. Repeated infections, fever that is coming and going since 5 to 6 months, night sweats, and extreme fatigue. These people get fatigue even after doing a small activity. There can be a swelling noticed by the patients inside the abdomen while taking bath or while the poking the belly. He feels something hard inside his abdomen. On this testing, we see low WBC, low hemoglobin, low platelets, and on examination, we see a spleen that is enlarged. It can enlarge from 6 centimeter to 12 to 14 centimeter as well. How we diagnose it? The diagnosis mostly can be suspected on the physical examination when there are no lymph nodes, only splenomegaly is present. Second, doing a bone marrow test. In bone marrow test, sometimes aspirate doesn't show any features, but on flow cytometry, there are typical markers which are present in hairy cell leukemia can be identified. Bone marrow biopsy can also show some typical markers that are characteristic of hairy cell leukemia. Coming to a last point, what is the treatment option for hairy cell leukemia? The hairy cell leukemia, the most effective treatment is cladribine. This is one type of nucleoside analog that inhibits the activity of the proteins that leads to a hairy cell leukemia. This drug is quite effective. Most of the patients respond to this single agent. Sometimes we give other family member of cladribine, that is called as pentostatin. Second are immunotherapy options like rituximab. We offer for patients which are not fit for cladribine. Third, when the patient doesn't tolerate any of the treatment, then we can offer a treatment like interferon alpha or sometimes splenectomy as a desperate measures. So conclusion of this study patient is hairy cell leukemia is a very slow growing cancer of the B lymphocyte. If diagnosed accurately, the treatment options are available. Sometimes people with hairy cell leukemia live for more than 20-30 years if properly treated. So whenever you have a suspicious or a diagnosis of hairy cell leukemia, please take advice from the expert hemato-oncologist who is specialized to treat such disorders. For more personalized treatment, please visit your healthcare provider, that is hemato-oncologist. Till next, stay tuned, stay updated. Thanks.